Always come with an open mind. Always come with your door opened, because you never know when opportunity is going to knock, and when it does, grab it. Just know that every day when you come to work, you just never know. What you do is going to be so impactful to a patient, to a family member, even to a coworker. I'm TERESA LUDOLPH. I work currently in the Digestive Health Center. I've worked here at St. Luke's Hospital since 1974.
I'm Julie Bear, and I work in the laboratory, and I've been with St. Luke's for 30 years. I started in April of 1989.
My name is BRET BLAYLOCK. I work in security. I've been working here since December 26, 1978.
I'm Joellen Fromwell. I'm manager of St. Luke's Emergency Department. I have been here since 1998.
The dress code. We wore starched hats, we wore starched uniforms, dresses mostly is what we wore, white hose, white shoes, they kind of look like orthopedic shoes. And when I started here, we had glass thermometers, we had aluminum, steel bedpans, metal bedpans. We capped our needles. We did not wear gloves.
We had a fair amount of testing that involved manual mixing and measuring of reagents and patient serums, and that has completely changed. Everything comes kind of prefab.
I remember when we got our first fax machine, we thought that was a real game changer, because we all stood over it and just watched this information just magically appear in front of our eyes.
The size of the facility. I mean, we've expanded buildings and parking lots and ramps. You got to imagine when I started here, SurgiCare wasn't even there. So the Women's and Children's Center, all the parking lots we have now and the property we patrol, not to mention the main facility and how much it's changed inside.
I'm entering healthcare right after HIV is really a big concern, and where bloodborne pathogens, before I got into the field, it was not unusual for people to be smoking and drinking their coffee at their bench assignment and doing their work.
When we made patient rounds with our physicians, we held their charts for them, and sometimes we held their cigarettes while they made rounds on patients. Our patients could smoke, our staff could smoke, and our physicians could smoke.
During the flood of 2008, I was very proud of the staff and my team members. They absolutely pulled together, and we were working with the Mercy nurses as well, because Mercy was closed. So it was a joint effort and a lot of teamwork and some quick learning on the go.
The flood was memorable. We were super busy, the emergency power was on, we didn't have air, and we were getting all of Mercy's patients. A lot of people were upset, it was hot in the hospital. We also had to help Mercy Hospital. We actually went down there and patrolled some of their outer parking lots.
That was certainly the worst of times, but it absolutely was the best of times, because it was everybody worked together. We never had to ask for a thing, it came.
I'll never forget the first blood drive we had after 9/11, and I remember walking in to the blood bank that day, and we had a staffing down at the city of Cedar Rapids for a blood drive, so all the city personnel were giving blood already. And we had so much blood in those weeks following the 9/11.
The best part of my time at St. Luke's has been probably the lifelong friendships I've developed. Being in a hospital setting is very challenging. We are here 24/7, 365 days a year. I've spent just as many nights and weekends with my team members as I have my own family. The importance of having those friendships is, even 20 years later, my family doesn't understand what we do and how we do it.
One of the primary things that gets me up in the morning to come into work, to work at St. Luke's Hospital, is I think the level of pride I have for our organization, and not just here in the Cedar Rapids region, but in the entire system.
Please understand that at any given time, when you take care of a patient or you take care of a family member, that what you do can be extraordinary. And you don't even realize that. You just think you're doing your job, but it could be extraordinary to a patient or family.